Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. And this week we're going to be talking to you about alternatives to cortisone and other types of steroid injections. As you all know, sometimes joint pain or spinal pain can be so severe you just need to alleviate your symptoms. And one of the more common types of injections that you see all the time are cortisone or steroid injections. Yes, these injections are great for alleviating your pain at a very quick rate, but what most patients don't understand is these injections can be detrimental to the tissue by accelerating that degenerative process so that you end up having more problems down the road. This week, Dr. Michael Marciello, our medical director, is going to be talking to you about the different types of regenerative medicine injections that you can certainly choose from that will help repair the damage that's occurring without the side effects of degrading the tissue. Take it away, Dr. Mike.
What is cortisone? Or what is steroid injections? Well, there's a lot of misconception out there in relation to someone saying, I received steroids, but I received cortisone injections. Well, cortisone is short for corticosteroid. So corticosteroids, in fact, are one and the same. So steroid injections is the same as if you got a cortisone. Now, there are like a lot of things in the world. There's different brands of cortisone that you may receive, and different doctors use different cortisone to inject your joint or give you a cortisone injection for your inflammation. But I wanted to really discuss today about ways in which we think of alternatives to cortisone, because it's not to be taken lightly. Cortisone injections, or steroid injections, again as we call them, can be problematic. They may cause problems. There are a lot of side effects to a lot of things we do, and cortisone is one of those things we have to not take lightly. If we think about cortisone in relation to the way it works, well, it's an anti-inflammatory medication. It's an injectable anti-inflammatory medication. We could use a sister medicine if you think about the word prednisone. Well, prednisone is the oral form of the steroid. So you might have to take prednisone for some inflammatory systemic problem. But when we get to the cortisone injection, we like to think about ways that we can minimize that procedure, because again, it does cause problems. Many things that happen from a cortisone injection we get concerned about in our office here at Maragal Medical is because they can cause problems. They can cause tissue degradation when we inject it into a joint. So actually you might be getting some relief to your joint pain or your joint swelling, but it may in fact cause some degradation or damage to the cartilage tissue that you're actually having problems with. If you inject it into a tendon, it can weaken that tendon. It can actually make the tendon rupture if you get the cortisone injection too frequently. So again, we don't want to take it lightly, but there are a lot of things we just need to think about, and you should all know what happens if you use cortisone, and certainly if you use too much. Well, if you have dark colored skin, if you're brown or black skinned, the cortisone injection may actually blanch the skin. It degrades the melanocyte, so you don't actually have the pigmentation of the skin. If you inject the skin a little just beneath the skin tissue in the subcutaneous fat tissue, that tissue could dissolve or actually break down, and you now have again a very thin skin that becomes friable, dry, and can easily damage. If you have diabetes, if you have some other medical problems, the cortisone, although it's local injected, you may have a temporary bump in your blood sugars, and we have to be cautious of that. It can reduce your immune system, so you may have a risk of an infection to the joint or a systemic infection if you're susceptible to that, such as if you're diabetic. So again, we really need to think about alternatives to cortisone injections when you need to have a treatment for your inflamed tendonitis, bursitis, or perhaps arthritis. Well, as we talked about many times, we think about the ways in which we have to address your problem. We don't want to just treat your symptoms, so we have to think about, this cortisone injection works wonders to get that pain down rapidly, gets the inflammation out, but it doesn't really necessarily heal anything. In fact, as I just mentioned, it could degrade the tissues that it's injected into. So we want to think about alternatives to that choice. If you have arthritis in your back, you can maybe receive a number of injections, multiple joints at different levels. But what else is the option for cortisone? Well, you may have gone to the pain clinic. You may notice that they want to offer a radiofrequency ablation. Well, that might give some pain relief to your joint arthritis in your spine, but it's damaging the nerve ending to the joint to give you pain relief. Once again, treating the symptom. We think about regenerative medicine here at Maragal Medical. We want to make something not cause harm, we rather have repair. Regenerative injections come in many different forms. There's allografts of Wharton's jelly, which is an umbilical cord allograft. There's amniotic tissue allograft. There's bone marrow allograft, or that's an autologous injection where you take your own bone marrow out, inject it back into the joint. You get pain reduction, you get anti-inflammatory effects, you get relief to the joint, and you may in fact heal some of the tissue that is damaged. So regenerative injection is what we think about, ways in which we can think of that first and think of cortisone next, or not at all. If we think about what comes in along with a regenerative injection, there are other alternatives. For soft tissue, muscle tightness, or maybe a knot as we describe it in our trap muscle or our back, we can inject so-called trigger point injection. You can use a lidocaine, which is Novocaine. We tend to use a natural product from a pitcher plant called Serapin. That can be helpful to help reduce that muscle tension and tightness, so we call it trigger point injection. We may do a tendon injection with the same material, and again, not use cortisone, or another option, an alternative, is called PRP, platelet-rich plasma. We actually do a blood draw from your own body. We take that blood sample and we spin it down in a centrifuge to get to the plasma level. The plasma level will actually be re-injected. And what's in plasma? Platelets. Platelets can cause the body to heal. It brings in growth factors, it brings in collagen, it brings in tissues that makes the inflammation go away and heal some of the tissue. Once again, we're trying to repair the joints, repair the tissues we're injecting. So we want to make sure you all understand that cortisone is not to be taken lightly. Cortisone can be very helpful. I use it certainly many times and for good reasons, but we try to minimize it. We try to prevent repeated injections of cortisone. We will commonly mix lidocaine with cortisone if we inject it, because it gets immediate pain relief from the Novocaine, and then you'd have the cortisone for short-term relief. But don't forget about those side effects. Don't forget about the problems that cortisone can provide or cause. Come to our office. Let us give you an evaluation first, and I'll tell you if it potentially could help you. Should you go and pursue that cortisone, or could I give you some alternative options to help you get back to your movement and treat your joint pain, your arthritis, and those musculoskeletal aches and problems? Give us a call. Let us evaluate you. Come on into the office. We'll talk to you soon. See you next week.
That was great information, Dr. Marciello. Doesn't it make sense to choose a completely safe regenerative injection that's going to help to repair the damaged tissue versus an injection that is actually destructive? It will certainly help alleviate your pain, but in the long term, it's going to destroy the tissue, which means that you'll have more problems down the road. If you'd like to see more information like the information you saw today, please subscribe to our YouTube channel. More information about our practice can be found on our website at maragalmedical.com. We're a unique physical medicine practice where we combine medical care, chiropractic treatment, and physical therapy, and we take most insurances. We're located here in central Massachusetts. Folks, remember, your health is your most valuable asset, and you should have the ability to access that asset each and every day without limitation. At Maragal Medical, we treat the patient as a whole and look at you from top to bottom, inside and out, specializing in regenerative medicine and integrated nutrition. More information can be found just like this by tuning in next week. I wish you all a super day and have a fantastic week. Talk to you soon.